I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. Our guest today is a friend and a colleague, Justin Amoyal. Welcome, Justin.
Thanks, Craig. Really happy to be here.
So the first thing I want to start with is about who you are and how did you get involved in working in the field of intellectual and developmental disabilities?
So for me, my introduction to the field kind of had a tragic beginning. I'm an engineer. I've been an engineer since I started going to college at George Mason University. My junior year, I got an internship at Lockheed Martin. I invented this system to help with optimization and basically stopping errors during aircraft production. And that kind of became my thing that I was focused on, is optimization, error reduction, making processes more efficient. If we fast forward to 2019, I lost my brother to an overdose. And when that happened, I just didn't want to work in this government consulting world anymore. I wanted to focus on this medication management issue. And I really had no idea what I was getting myself into, nor did anyone else that I started this journey with. And so soon after, we started tinkering with different technologies. We found out about this program that the National Science Foundation hosted called I-Core, and we went through their regional program. We interviewed the whole program's about customer discovery. So it's all about talking to the people that you might actually solve a problem for and learning from their perspective what needs to be solved and how it should be solved. And so after doing the regional program, we got selected for the national program. We won a grant, but that was really our entrance into the IDD world. We started doing all these interviews with different enterprise settings, everything from skilled nursing facilities to assisted livings to supported living agencies and group homes alike. And we learned that there was this huge issue for medication management in the IDD group home or supported living setting. We went on these tours of facilities or homes where they had file cabinets to store meds and paper and pencils to track records. And it was just absurd. I mean, we saw nurses sorting through drawers for 15 minutes to find the right blister pack. And we basically just knew this was where we had to focus our energy. And so as we started doing those interviews and being more focused into that sector, we had organizations asking to use our platform before we even built it. And so that's when we really were confident that, hey, that's what we need.
So let's talk about the platform and the company. So the company is called Impruvon.
Yes.
Impruvon Health, right?
You got it.
Right.
Yes.
Okay. And you're the CEO.
Yep.
All right. And tell us about the platform, what the company has developed, how it works, how it solves the problem you've identified.
Sure. So what I like to say is we're taking cutting edge technologies from other industries and trying to bring them into this industry. I think it's honestly sad that this industry has been neglected from the perspective of technology for so long. And it's awesome that we have these great engineers that are willing to contribute and build really nicely working technology for this sort of industry. And so what we do is we try to equip each role within the organizational hierarchy: administrators, nursing staff, DSPs, residents on the internal stakeholder level, and on the external stakeholder level, we equip pharmacists and loved ones and guardians with roles in our platform so they can stay in touch and understand what's going on. So a simple workflow that we obviously will help with is a med pass. We can send reminders to the staff. We have a connected med box that works with our apps. And so once the staff gets those reminders, they'll be guided through a workflow to help ensure that they follow the 6 rights or the 8 rights now of medication administration. Yep. They can barcode scan through our app, and when they click the button to access the meds, they only have access to the right meds at the right time for the right people from our med boxes.
That's a lot of rights covered right there in that one little
That's right.
box.
Lots of them.
That's kind of what's interesting. You know, when we first started talking, I was thinking, okay, this is an electronic medication record, but that's not what you guys do.
No, and I'm really glad you're bringing that up.
Yeah.
Yeah, so an EMR is a component of our platform, but we work with a bunch of EMRs that are already out and already in place. Like the last thing we want to do is get in the way of something that's already working. So we can drop data into an EMR. I think EMRs are a great place to do exactly what they stand for, an electronic medication administration record. But what we really focus on is the workflow. So we're there with the staff while they're doing the actual jobs. If there are residents that can self-administer their own meds, we guide that resident through that workflow. We really help them attain independence. We have a routine repetition and rewards-based system built into the platform. so we can really incentivize them to reach goals like managing their own medications.
Yeah. So the one part of it is that you have software, as you said, but you also have an actual physical component to this that I thought was interesting too. So how did that come to be developed? And I know you explained a little bit about how it worked, but go into a little bit more detail.
Sure.
Like how an agency would actually use that device along with the software.
So what's really unique about our devices is every single one is fully double locked. Every drawer in our devices are double locked.
One of the big concerns about medications, anywhere, is they have to be appropriately locked and stored for multiple reasons.
Right, exactly. And what happens is now these orgs are forced to kind of like recreate the homes when they buy them or when they're trying to set them up to become, a setting that could be to support individuals with intellectual development
When they
disabilities.
don't use what you have, you're right.
When they,
you've got to figure out a cabinet within a cabinet a lot of times.
Or a whole separate med room.
Exactly. So you can just to keep the medications appropriately stored.
Yeah, and like within that system, it introduces all these inefficiencies. Right now, you need to go into this separate room and figure out where the key is for that lockbox. And I can't tell you how many stories we heard about DSPs or nurses going home with a key. The next shift starts. No one knows about it. Now you can't even access the meds for the rest.
I'm well aware of those as well too. I've heard those.
Yeah. And there's so many crazy stories like that. So with our system, there are no keys. Everything is driven by the app. We know who the right people are at the right times from the back end. No one is typing in medication regimens. The data flows into Impruvon directly from the long-term care pharmacies that support these agencies. So it's not just the MedPass that we're focused on. It's all the workflows around it that make that possible. Tracking inventory levels of the medications, alerting the pharmacies when these inventory levels fall low. Most orgs are required to do that right now for narcotics. They have to do manual narc counts at the end of every shift. But they run into problems all the time where they're not tracking inventory levels for a PRN or an over-the-counter med. And so we've learned through trials and tribulations with many, many teams and have deployed now these solutions for these problems that just pop up that people aren't necessarily thinking about. The great thing about Impruvon is you don't have to think about them anymore. We're kind of working in the background and we remind and send alerts when things pop up that we need to get a human in the loop to make a decision for. But if it's something that is kind of like an organizational standard, we're able to automate it for that organization.
So going back to the actual box, you mentioned that it unlocks at the right time or appropriate time. What if a person's not there, they're running late? Does this box still automatically unlock at that moment?
Yeah, thanks for taking me back there. Sorry, I kind of skipped that part.
That's quite all right.
Yeah, so the box has to be prompted to open at the right time. So we know the staff at the specific sites that are allowed to access those meds for those residents at those times. So when the staff hits access, only that blister pack or set of blister packs will be available for that time. If no one's there, then no one will hit access. If a staff doesn't show up one day and you need to drop another DSP in, which happens all the time, as you know, an administrator can remotely unlock the box too.
Okay. Yeah, because I'm always thinking about safeguards when it comes to medicines, and and that only the right people should have access to them at the right times and all. But make sure, it just didn't pop open and then like, oh, there's a bunch of medicines.
No, yeah, exactly.
I figured you had handled that pretty well. So, yeah. So this is a solution to a problem for a lot of people.
Yeah,
I know you've talked to a lot of people about this and looked for like you said, you were talking with people and trying to figure out what problems needed to be addressed, which is where you saw the need and why you built what you built. What are people saying about this now that they're using it?
Oh, I mean, that's the best part of my job. And we just helped an organization in California reach 99.6% medication compliance in 6 days. We helped another organization in Virginia last month. They told us their average, I won't say their name, but they told us their average was about 70%, 65%. We got them to 99.8% compliance.
70% what?
Medication compliance. Exactly. So we'll take that down as missed doses, late doses, things like that.
And so you brought them up to
99.8 in 18 days. 18 days.
18 days.
The Virginia one.
That sounds like a pretty good solution to an issue that everyone in this field deals with, for sure.
Yeah, and like the compliance and the metrics, that's great. Like, when the organizations get surveyed, that they'll be able to spit out a report that makes that really clear and evident. But like the most amazing thing is we implement and you can just see the reaction for a lot of the DSPs. They're like, wow, someone actually understands what we have to do every day. And this app now guides the process. Like, it makes this easy for us. And that's what these organizations, at least from my perspective, really need. Is there's obviously this healthcare hiring shortage, which is very hard to overcome for many of these organizations, increases in minimum wage, and all these problems culminate to basically force organizations to have this hybrid workforce. You can't have as much clinically trained staff today, I guess, as you used to be able to. And so that means we need to equip the less clinically trained staff with easy-to-use tech that can make them operate almost as if they're clinically trained. And that's basically what Impruvon does.
Now, sometimes when we implement new systems, there's a thought that, well, this is just something else we're adding and it's going to take so much more time. How does what you do affect time in medication passes?
You got to join our sales calls, Craig.
I listen occasionally to what you say.
We had a conversation yesterday with an EHR that we're hopeful to partner with, and one of the reasons they're so interested in partnering with us, I think, is they disclose that it takes them about 6 to 9 months to implement for a new site. We can implement 10 sites in a week. So we move super fast. A big reason for that is these integrations that we have set up. So no one is typing in medication regimen. We have preset roles.
I want to get to that in a second. So don't let me forget, but let me go back to the time. How about time of medication pass? A medication pass?
Oh, great question.
Does it shorten that? Does it extend that?
Yeah, so we haven't done any studies, like full transparency.
What are people saying?
Yeah, so we do surveys with our customers after they're fully implemented, and they're saying they save, on average, 16 minutes for every 5 people that they're administering meds to. And that doesn't sound like that much.
And that's in one med pass you're talking
for every 5 people, yeah.
Who might receive meds 2, 3.
That's exactly right.
4 times a day.
Yeah, see, it's clear to you.
I've been in this field a little while.
Yeah.
But you add that up, you're talking hour and a half a day, maybe, that people are saving.
Yeah, and it's not quite enough to say, hey, reduce your workforce, but what causes errors is these staff are super overwhelmed. They're put in a position where there's just not enough time in the shift to do everything they're responsible for. And so any time they can save is huge. It just reduces the stress. It allows them to complete some of these competing objectives that they otherwise wouldn't be able to.
So I told you to remind me what to go back to. What was that? Because I already forgot.
I think it was into data flowing in from the pharmacy. Was that it?
Yeah, it was connections with the you mentioned not having to input medications and all of that too, right?
Yes.
Which is a big plus, I think, for most people out there.
It's a big plus for us too, because we don't have to remedy a bunch of errors with people typing the wrong data in. And
so you get the data straight from the pharmacy software.
Straight from the pharmacy software.
Like the original order was put in.
Yes.
And so it comes straight from that.
Yep. Like a great example, one of those solutions we're integrated with is QS1. So QS1 is used by long-term care pharmacies across the country. We're integrated with QS1. We start working with a new residential provider. They work with Pharmacy A. We call QS1. We say, hey, can you please turn on the interface for Pharmacy A? They flip a switch. The data flows into Impruvon.
That's pretty sweet there, it sounds like.
It has been. So the QS1 team is also amazing.
That's excellent too. Good job, QS1. So what's happening? What's the future? What are you working on? What are the secrets?
Secret stuff?
Secret things that are in development right now.
So something we're kind of beta testing right now internally, and we have one site playing around with it, is this big gamification module that we built. So we worked on the study with the Frist Center for Autism Innovation and the College Autism Network, where we interviewed about 150 neurodiverse individuals. Everything we do is driven by the people that actually use the tools. We don't want to make these decisions. And so we asked all these questions around basically, what's your preferred mechanism to receive health-related instructions?
I'm going to stop you right there just to point out that is a person-centered way of thinking.
It is.
And that is what this field, is moving towards and needs to be moving towards, is looking at what the person wants in their lives, needs in their lives, finding the balance between what's important to the person and what's important for the person, but most importantly, listening to them and bringing them into the setting. What will make your life easier? And you're doing that.
Yeah, I mean, which is like, honestly, it doesn't make sense that like a neurotypical person like myself or our CTO would make these interface decisions. Like, you need someone that's actually using it to tell you what they want to use.
Yeah.
So we ran this study, and then to take it a step further, we hired 2 neurodiverse interns that have helped us now develop the actual interfaces that are going to drive this gamification system. And so the way that it works is it's all about independence, routine, repetition, and reward. So we send reminders as you take your meds on time in the right amount, self-administering them. You get an in-app reward in the form of tickets, and you can use these tickets to buy different characters in the app. You can play games in our app now with those characters, and we've got ambitions to take that to the DSP level too. It won't be as gamified per se, from the perspective of, if you saw it, there's like cartoons in the app and games, but the goal is to create leaderboards and reward staff for basically being in high percentiles of medication compliance. So maybe a staff member's in the top 90% of compliance for that month within the organization, they get a $25 gift card. So that's something cool that we're working on.
Yeah.
We're working on hopefully a lot of state-based waivers. We're right around the finish line right now for Missouri, pretty much clear through there. So very excited for that. Thank you everyone in Missouri who made that possible. But Brian Connery is someone we just hired. He's very experienced in waiver processing, and he's been a huge help there. So we've got a couple other states that we're working towards by the end of the year as well.
Yeah, just understanding the waiver process can be a challenge in and of itself. It took me quite a while.
I'm still learning it.
Yeah, and yeah, same here. Still every day. And hopefully there's some good opportunities with other companies. Wink, wink. For us to work together too. So maybe we'll be able to talk about those opportunities.
Yeah, didn't know if I should mention any of that. The most exciting future opportunity.
Yeah. Let's leave that as a teaser for the next time.
Okay.
But I do want to ask you something that I ask all the guests. If you could give 3 tips, 3 words of wisdom, 3 things for listeners to think about related to improving health and wellness, or in general supports and services for people with intellectual and developmental disabilities, what would you recommend? What would you like people to think about?
One thing I would say is, if you just go to a residential provider location, or for that matter maybe even a day program, and you see what's happening today, you're going to be motivated to probably want to help. And there's a lot of workflows and systems in place today that could use a lot of help. And I think something that's exciting about the IDD market is they do need help. And if you're, I don't know how else to say this, but if you're a good person and you see someone that needs help and you're capable of helping them, you should. And so that's one thing I would say, is go actually see one of these places. Like you told me last night, and I was really thinking about this, is like, unless you have someone in your family that has an intellectual or developmental disability, you really have no idea what goes on in these sorts of locations. And so
that was very true for me.
Yeah, that was true for me too. And there's a need. So I think that's one big piece. I think the second thing I would say, which you kind of already called out, is anytime I think you're trying to build technology, you should let the people that are going to be using it tell you what it should be. We made that mistake really early on. We started trying to build the solution before we went through that National Science Foundation program, and threw all of that technology away. None of it was useful. And once we started, actually, we do this to this day. Like if we're going to work with a new customer, the first meeting we ever have is a discovery call. We just want to learn about them, and we'll tell them, hey, if it seems like your process is great, you don't need us. So I think that's the second thing, is like listen to the actual people that are going to be using it. The third thing to improve, I think, is it's just access. Like I think something that we've done that I'm really proud of, I'll call out Tony, that's our CTO, and all of our engineers for that matter. You guys are the best. Our system works on any device: phones, tablets, computers, Android, iOS, native apps on those devices, web-based apps on those devices. So it doesn't matter what the organization has before we meet them. We already know we're going to be able to implement, and it's going to be easy to implement. And I think for companies that are thinking about building tech for this industry, that's something to really think about, because just like you mentioned, you're still learning about the waivers. You're 3,000 light years ahead of me. but it's different for every waiver. It's different for every provider. Like, everyone does things a little differently. One provider might have Chromebooks in every home. Another one might have Android tablets. And you don't want to constrain yourself to not be able to work with someone because now they have to spend an extra $50,000 buying devices for all of them.
Try to be universal in what you develop and design.
Yeah.
Yeah. Those are 3 great things.
Thank you.
Among many great things that you guys are doing. It's I tell you, it's been a pleasure getting to know you.
You too.
I look forward to working with you, hint, hint, in the future to solve some problems. And I just have to say, you have an amazing mind. You've got an amazing heart.
Thank you.
Putting those 2 things together makes for an amazing business. And
Thank you.
I can't wait to see where Impruvon goes in the future.
I really appreciate that, Greg.
Thank you so much, Justin, for being with me today. See you next time.
Yeah.